Hi y'all, today I want to discuss culturally responsive care and how a busy speech-language pathologist can practice culturally responsive care when you already have a lot going on but you still want the best for your patient. Culturally responsive care is essentially just taking your patient's perspectives, values, their beliefs. You take those things into consideration when you make treatment plans, when you assess, when you make recommendations. But how do you know what your patient's cultural perspective, values, and beliefs are? Well, you could do something called active listening. Active listening is an interviewing technique that us SLPs can use to gather more information from the patient, to hear about their views and their thoughts and their feelings. When you first sit down with the patient and you want to discuss a certain topic, maybe it's you just finished an assessment, you realize maybe having a modified diet is a way to go. You give your recommendations and you want to hear your patient's thoughts. So you could set up the interview by saying, this is my plan. This is the reason for my plan. Here are the benefits of being on a modified diet. How do you feel about it? You ask an open-ended question. And then you wait for an answer. You set your pen and your clipboard and paper aside. You're really showing that you're listening with your body language. You are also exuding acceptance and non-judgment. This helps build trust and rapport between you and your patient. It creates a safer space so that the patient could feel like they are in a safe enough space that they can share what's really on their mind. While your patient is talking, pay attention not only to the words, but their body language, other nonverbal things. And when they're speaking, you want to try to understand the intent behind what they're saying, the emotions behind what they're saying. While they're speaking, pay complete attention to what they're saying. Lean your body forward. You could nod and smile. Try not to interrupt so much with or I feel you. And lastly, for active listening, repeat what the patient says exactly how they say it. Try not to paraphrase, try not to summarize. Literally repeat back what they're saying. It feels a little bit awkward at first, but it works like magic when I've tried it. People feel really understood when you repeat their words back to them. People feel like they've been listened to because you have been listening to them very clearly in order to repeat exactly what they said back to you. So for instance, the patient might say something like, modified diets sounds a little bit gross, but I'm willing to try it out. And you feel like that's all they have to say. You give them time and space to talk. And then you say, it seems like you think modified diets are gross, but you're willing to try it. Is that correct? And you also want to make sure that you understood or you heard correctly. Is that correct? Did I hear that right? Is that what you're trying to say? That kind of tag question at the end can open up for even more discussion. So once again, culture responsive care is really trying to understand where your patient is coming from their culture. We're going to meet a ton of different people, and each person is a mix of different cultures, just like us. So it's always a learning experience as you're discussing with your patient, using active listening so you can learn even more about them, so you can make sure that your treatment plan not only is going to be functional for them, but meaningful for them and something that's motivating to them. You can learn more about culture responsive care. We have this fun little cheat sheet. It is available as a PDF on our Etsy site. Check out Adult Speech Therapy's Etsy site for more info.